Good morning. Good morning, students. Here, today we will discuss about malignant epithelial tumors. In the last class, we have already discussed malignant epithelial tumors. The common one is the squamous cell carcinoma. Today, we will see another one, which is the malignant melanoma. These melanomas are malignant neoplasm arising from melanocytes of the skin or the oral mucous membrane. So actually, they can arise de novo, or they can arise from pre-existing lesion. For example, melanotic nevi. Neoplasm initially has a radial growth phase, and which is followed by a vertical phase. These neoplasms are unpredictable. They are fast spreading, and also they are mostly deadly among all the malignant tumors. So, two neoplasms or malignant neoplasms which you should remember. First one is the squamous cell carcinoma, which we had discussed before, and the second one is oral malignant melanoma. Now, primary mucosal melanomas have more aggressive behavior, and they have poorer prognosis when compared to the melanomas that is arising from the skin, or you can say cutaneous type of melanoma. So oral melanomas are more aggressive and more dangerous because they involve, or they are very aggressive in the sense they are locally very invasive, and also they spread to different parts of the body. They are metastatic to different visceral organs. So they have a very poor prognosis when compared to cutaneous melanomas. Because of the unusual anatomic location in which they occur, it's not easy to detect this lesion at an early stage. That is the main drawback. Suppose you see a melanoma in relation to the posterior part of the maxilla, the alveolar region at the backside, there is less chance that we see initially, unless you do a thorough examination of the patient. Mucosal melanomas are virtually diagnosed at a very advanced stages. That's the problem we face. So it is always we should tell our patients to examine their oral cavity and make a visit to a dentist every 6 months for overall health, or intraoral health actually, whether there is any fillings to be done, you require any periodontal therapy. At that time, sometimes it is incidentally found, these melanotic lesions. So it is mandatory that everyone goes for a checkup every 6 months. Now, unlike squamous cell carcinoma, they don't mention smoking or use of tobacco as the main cause for melanomas in the oral cavity. Melanomas of the skin, they say it's mainly due to the sun exposure because of the exposure to ultraviolet rays. Now, sun exposure is could be uh, because of occupation, like many people do their work outside in the sun, probably the painting workers or any workers who are doing some job in the open areas, laborers, and those who work outside the building. And sometimes the sports people, like those who are always outside having some, for example, cricket or a football, professional players, they are always, many of the time they are half of the time they are outside the building, into the open areas while they play. So these are our predisposing factors. Exposure to ultraviolet rays from the sun. Then they say fair skin, red hair, and people with freckles on the skin, they are all prone for melanomas. They also say that higher socio-economic status is also a predisposing factor. So the exact etiology of this melanoma is not known. When you see the patients affected by this malignant neoplasm, you see that most of them are little aged people, around 50 to 70 years. They are usually occur in the fifth or sixth, seventh decade. More males are more prone for this neoplasm than the females. And of all the melanomas, around 2 to 8% occur in the oral cavity. All occur in different parts of the body, either as a mucosal melanoma or cutaneous melanoma. Melanomas of the mucosal region are not restricted to oral mucosa, but it could be seen in the females in the vulvovaginal region. It could be seen in the mucosal region of the eyes, or it could be seen also in the mucosal region of rectal and anal region. So these are all the sites where you have mucosal melanoma. And only 2 to 8% of all the melanomas occur in the oral cavity. And in within the oral cavity, if you see the location of this tumor, it is found that most of these tumors are seen on the hard palate and the maxillary alveolar region and also on the gingiva. So that these are the main locations. And of course, there are other locations. It's not restricted to these sites. The other locations being the floor of the mouth, melanomas can be observed on the lips, the buccal mucosa, tongue, etc. So all these areas are prone for melanomas. If you see the clinical types, there are many clinical types of melanomas, like for example, superficial spreading melanoma, lendigo malignant melanoma, acral lentiginous melanoma, mucosal lentiginous melanoma, a melanotic melanoma. These are the variants, different variants of melanoma you see. Now, within the oral cavity, how does a melanoma appear? You see, the melanomas are mainly a macular pigmented type of lesion. So maybe they are merging or they are in confluent with the oral mucosa, or it could be raised from the mucosal bed. As there is proliferation of these melanocytes, the neoplastic cells, these lesions which appears macular in the beginning may eventually they may appear slightly nodular or plaque type, and there could be ulcerations on the surface. So melanomas, you find they are mostly dark brown to bluish black in color, and sometimes they are virtually black in color. And in some cases, you may not find the color difference. It may appear same color as the oral mucosa. So such melanomas will show slight nodular growth which bleeds on probing. This can be seen especially on the gingiva. And such melanomas which doesn't show characteristic bluish black color or black color, you call it as a melanotic melanoma. A melanotic melanoma doesn't show the typical color of the melanoma. Now, this melanomas, which initially appears as a small speck of lesion, like for example 0.5 centimeters, it may spread rapidly, very rapidly it may spread, and you have a diffuse kind of a lesion eventually. And Patient may complain of bleeding, like hemorrhage, and there could be paresthesia in that region. Or if it is ulcerated, they also come with additional secondary infections. Like, for example, you may come with a fungal infection in the affected region. So these are how they are presented in the clinic when you observe the oral cavity. And near the lesions, the main lesions, you may find satellite lesions. That is away from the main lesion, small patchy melanotic areas. You call it as satellite lesions, which are found adjacent to the primary lesion. So it could be multicentric also. Like you can have it in the floor of the mouth, at the same time you can have it in the buccal mucosa. So not restricted to one single side. There can be multi-centric type of lesions. And there is not much of induration as you see in squamous cell carcinoma. That is fixation to the underlying tissues. That is not a big major feature of this melanomas. But if you leave it untreated, eventually they have a vertical phase of growth. They reach the papillary and reticular layer of the connective tissue, and they eventually extend to the submucosal region. And from submucosal region, they can eventually invade and reach the bone. For example, the jaw bones, and cause lesions there. So if you take a radiograph, you may find radiolucency depending upon the involvement in that area. And once the alveolar bone is involved, you find that there is mobility of teeth in that region and eventually exfoliation of the teeth. So these are the clinical features you observe in the oral cavity. Thank you.